Today we will discuss the topic which is achieving peak bone mass in adolescents to prevent fracture. This is very important topic because this is the factor, this is the key determinant factor, that is a peak bone mass is the key determinant factor in preventing the osteoporosis and the fragile fractures, especially in the postmenopausal patients. Osteoporosis is supposed to be a bone thief because it slowly absorbs the bone mass and destroys the bone mass without producing any symptom. It is a process it is a progressive systemic skeletal disease characterized by low bone mass with consequent bone fragility and susceptibility to fracture, typically as a result of hormonal changes or deficiency of calcium and vitamin D3. So, it leads to nearly 9 million fractures annually worldwide, and over 300,000 patients present with fragility fractures to the hospital in UK each year. The bone mostly composed of protein collagen, which forms a soft framework. The mineral calcium phosphate hardens this framework, giving it strength. The bone contains 99% of the body's calcium. Bones have an internal structure similar to honeycomb, which makes them rigid yet relatively light. The following are the components of the bone, which include the osteoblast and osteocytes, which are responsible for bone formation. Osteoclast, these are the cells which are responsible for reabsorbing the bone. Then osteoid is the matrix, which is composed of collagen and other protein. Then the other components are inorganics. Minerals, mostly the calcium phosphate, nerves, blood vessels, bone marrow, cartilage, membranes. There are numerous factors which affect the osteoporosis, and they are supposed to be the risk factors for osteoporosis, but the gender and the peak bone mass is the key determinant. The gender, in the sense that the female are more prone to have this problem due to the variation in the sex hormones, and also there are most of the time this deficiency of calcium and vitamin D is the women, and they have inactive lifestyle. The second important factor is a peak bone mass. We know that the bone formation starts in the infancy, in the intrauterine period from the third month of the pregnancy, and bone grows. But initially the growth is very slowly. But as the puberty reaches, there are the spurts of growth due to the effect of the hormone, which causes which suddenly increases the bone mass, and peak bone mass is achieved at the age of 25 years, and it remains till 30 years. After 30 years there is decline in the bone mass due to bone loss, and we can see here that the bone loss is quicker in the female as compared to male. Peak bone mass is the greatest amount of the bone an individual achieves. As children grow, their bone mass increases until it reaches what is called peak bone mass. PBM is reached in the late teens and early 20s. Children and adolescents who have higher PBM reduce their risk of osteoporosis later in life. Bone mass and strength achieved at the end of the growth period plays an important role in the risk of osteoporotic fractures occurring in adulthood. It is considered that increase of PBM by one standard deviation could reduce the fracture risk by 50%. Person who reaches peak bone mass with low bone mineral density has less prone to lose and is more likely to develop osteopenia and osteoporosis. Thus, the risk of fracture is greater and occur earlier in life. It has been shown that achieving bone mass during adolescent years could significantly delay the onset of osteoporosis by 13 years, thus reducing the risk of osteoporotic fracture in later life. Here you can see that there is a normal achievement of the bone mass and then gradually decrease. But if the influencing factor like the environmental factor, the supplement of calcium, vitamin D, the diet, the exercise are not controlled, then the bone loss is quicker in the persons than normal, and that leads to osteopenia and osteoporosis. What is the difference between bone mass and bone mineral density? Bone mass is the amount of bone mass as total of protein and in mineral in the whole of the skeleton of particular segment. ppm is the greatest amount of bone an individual can achieve. Bone mineral density test measures how much calcium and other types of mineral are in an area of bone. This test helps to detect osteoporosis and predict risk for bone fractures. Here you can see that is the measurement of the bone mineral density is done by using DEXA scan and T-score is given. T-score is given in the T-score is in particular person. The person whose T-score is calculated is compared with the T-score of the normal population, and then it is given as in standard deviation +1, +2, +3, or -1, -1, -2, or -3. Now, as the T-score decreases, the chance of having bone loss increases, and this leads to osteopenia and osteoporosis. The score of -1 to +1 is considered normal. The score of -1 to -2 point indicates osteopenia, and score -2.5 or lower is the osteoporosis. Now, the prevention of osteoporosis can be done by achieving peak bone mass during adolescence, maintenance of the healthy bone throughout life, prevention of bone with aging. Now, here we can see in the prenatal period, in infancy, in the childhood, or in the adolescent, there are many factors which affect the bone mass. These factors are the diet, physical activity, identification of the risk factors, identifying group with elevated risk, and planning lifelong intervention. So if all these factors are controlled, the person will enter with adequate peak bone mass in the adolescent. The peak mass will be maintained throughout adulthood as well as throughout aging process. Now, the factors which are affecting the bone health are hormones, nutrition, and physical activity. Hormones are very important in the maintenance of the health of the bone, because most of the time these hormones are the sex hormones or a parathormone which affect the growth of the bone as well as achieving the good amount of bone mass. And variation in these mass are either earlier in the age or the later in age will result in the weakness of the bone. Second factor is important factor is nutrition. Nutrition is very important because for the health of the bone we need proteins, we need minerals like calcium, magnesium, etc. We need vitamin D. So all these components can be provided by having adequate balanced diet. It has been shown in a study that the women who use postmenopausal women who use Mediterranean diet were not prone to develop fractures in postmenopausal life as compared to the other group. So the Mediterranean diet contains the seafood, protein in the form of seafood, fish, the dairy products, the legumes, the nuts, the vegetables, and the fruits, also the olive oil. All these components of the diet provide adequate protein, minerals, as well as calcium to maintain the health of the bone. If the person is not able to get adequate calcium, vitamin D from the diet, then it is supposed to have supplementation of these from the other sources. This table shows the recommended daily intake of calcium and vitamin D. Here you can see that during the adolescent age, the person needs more calcium as compared to the infancy and childhood, as well as the person also more should take calcium during the perimenopausal as well as the postmenopausal age. On the other hand, you can also see that the requirement of the daily vitamin D also increases as the age advances. The other most important element is the exercise, the critical for bone health throughout the life. Physical activity increases bone mineral accumulation in both children and adolescents. Strength or resistance activity and more strenuous exercise are beneficial. Just the aerobic exercise or running is not important. It has not been proved to be effective. Or so the take-home message is the main way to prevent having fractures to maintain bone strength. Peak bone mass is attained by the age of 25 years. Peak bone mass the key determinant of bone and fragility later in life. Age is independent factor affecting the bone strength. Optimization of calcium and protein intakes and weight bearing exercises during growth is an important strategy to optimal acquisition of PBM and bone strength and for contributing to prevent fracture later in life. Thank you very much.